We are coming to you from the industrial building. I'm with Cynthia Nunley, who is a health navigator, a government health navigator, who helps people sort of navigate health insurance, which is confusing at best. And if you remember, the period for actually getting this kind of insurance from the exchange was extended to August, right? How many people know that out there?
You know, we've had a lot of people who know it, but I've run into a lot of people who don't know it. We have three options running right now to help people get coverage. One is the special open enrollment through August 15th. One is for people who qualify for COBRA, getting help to pay for their COBRA. And one is people who have had at least 1 week of unemployment compensation will be able to get insurance regardless of income.
It is a little bit of an obstacle course, but if you think you may not qualify, you might want to check anyway. And 211 is a great number to call.
Exactly.
To get Cynthia on this. But tell me, who's excluded from this? Who's included in this?
You know, the people who typically are excluded are people who have employer-based coverage, people who make a lot more money than they ever thought they were going to. That's the beauty of this new special enrollment period, is that people who have made too much income in the past may qualify now. They really do need to come check just to see. Either give me a call or I can run them through the window shopping tool. And then, of course, typically people who don't make 100% of the federal poverty level, which means because we don't have Medicaid expansion.
Well, there's all sorts of complicated things that people have questions about. You may have lost your job, right?
Right.
You may have started a new job, and it is a little income sensitive. Why is that?
Well, what we try to do is make sure that insurance doesn't cost more than 8.5% of an individual or family income. And so that's why now subsidies are much higher than they used to be, because they're really holding to that 8.5%.
All right, it's very important to know. She doesn't sell insurance.
I do not.
She
sell
helps
insurance.
people navigate. She shows you the options out there.
I can help people understand. Maybe they qualify for Medicaid or Kid Care. Maybe they have Medicare questions. I can answer some of those or get them to the people that can help.
All right. So
and then I help with the marketplace.
You're going to be here at the fair in the industrial building.
Yes.
The length of the fair, is that
Yes.
correct? And then you have an event that's coming up in the library.
That's right.
At Natrona County Library. And when is that?
So July 28th from 10 to 6 p.m. Call the library, ask for the reference desk, and make an appointment. It is by appointment so that we can kind of keep people not having to wait for hours.
All right, Cynthia, if nobody understood this, they can call the 211 number and get a hold of you that way through some operators there,
You know,
right?
the biggest thing is we don't know what we don't know yet. And you've got to ask the questions, and I will help you find the answers. And that's my job. It's
Right.
a free service, and that's what
It's
we're
free.
here for.
And they can ask all the questions they want. And yes, the healthcare insurance deal is a little confusing, but she can help straighten it out. Thanks, Cynthia.
Thank you.